Hi, Charlie Coltman here, CEO and founder of Cancer Life. I just thought today's blog we would talk about 5 underutilized and underappreciated services that patient support services that cancer patients have access to and are available that um, sometimes that cancer patients aren't aware of. So the first one is if you're going through cancer journey, one of the biggest challenges is mental health. Obviously, the nature of the fear, the anxiety, the worry can have a dramatic impact on your mental health. And how do you manage that? There's from some statistics, 50% of patients experience some form of depression during their journey. It's completely understandable. And really rarely of those, only 10 to 20% actually get treatment or seek out help for those needs. But folks need to understand that if you're in some type of cancer center, typically they do have social workers that are available that you can schedule time with to go over. I wouldn't call them necessarily, getting a psychiatrist, but those services are where they can help you, one, navigate, your decision making, navigate your relationships, which is a huge stressor for cancer patients. And you really can get the support you need from folks that really understand how it works, what they've been through. These folks have seen it all. So, number one, social support services inside of cancer centers is really an untapped area to which you can seek help. Number two is inside those cancer centers, if you're having financial stresses around getting to and from your appointments or any of the other financial burdens associated with your treatment, talk to the cancer center and ask to see if they have assistance programs. So a lot of them do, right? There's a lot. Sometimes it's through their nonprofit, or there are other partners like the American Cancer Society that they partner with that has access to some of those services. Third, if you're in a clinical trial in terms of financial services and support, look to those clinical trial partners. The sponsors of those partners typically do have almost like a debit card that they give you to handle secondary expenses. That's a good area where you can seek support. So if you're in a clinical trial or planning to be, ask about patient support services associated with that clinical trial. Like I said, they'll give you a debit card, I don't know, $1,000 a month, $500 a month to handle those secondary expenses. Also, if you're having trouble paying for medications, doctors really don't make treatment decisions around, what's the cost to the actual patient. They don't know what your insurance is and what they'll cover and what they're not covered. They don't know what your copay is. But if you're under financial burden and your doctor has switched your medication to some newly approved drug or some other, treatment that's highly specialized, which means it's more money, talk to the pharmaceutical company that your drug that is manufactured by the drug. Talk to the manufacturer. They're called patient support services. Manufacturers give away billions of dollars in free drugs every year. There's a company called the Lash Group in which you can log onto their website, fill out some information, and you can sign up for get your drugs for free, essentially. It's frankly, a pain in the ass to go through the process. They're going to call you a million times to see if you've taken your medication. They're going to ask you a million research questions. But, in terms of getting something for free, is something that patients need to learn about. So go to your specific pharmaceutical company and log on to their website and find out if they have patient assistance programs. And the final one I just would like to say, in terms of nutrition, this is a big area that's happening now, is that the cancer centers are providing nutrition services through partners. At the very least, a lot of the time they're nutrition shakes. So if you're having trouble keeping on weight, you're having trouble eating because you get too nauseous, they do have those nutrition shakes that I believe they partner with Nestle, who provides these shakes. You can get those for free. So anyway, that's 5 services. I think, every cancer patient going through treatment, in order to get support, realize these are areas in which you can explore. All right. So anyway, Thank you so much.